Welcome to our first live webcast, Focusing on You, sponsored by Hope Abounds. My name is Lisa Cawthorne, and I will be your host for the webcasts, which are offered live on the second and fourth Tuesdays of each month. I'm a volunteer, an oncology nurse, and a breast cancer survivor myself. Hope Abounds provides support services, patient advocacy, and financial assistance for women, teens, and children who are newly diagnosed with cancer. We also support educational opportunities like these webcasts, which will not only air live, but can be watched on the Tuesdays following the live webcast. Today, we will focus on the topic of cardiac toxicity from cancer treatments. We have a guest today who's a survivor, and she has a story to tell us about her own experience with cardiac toxicity. So we welcome Kelly Barnes-Smith to Hope Abounds tonight.
Thank you.
And your parents founded Hope Abounds in response to your cancer experience. Can you please tell us a little bit about your diagnosis and treatment?
Sure. Well, I was living outside of Atlanta, Georgia at the time, teaching elementary music, 32 years old, and the last thing I was thinking of was that I needed to go to the doctor and what the doctor might say about some little spots I had discovered. And come to find out, my doctor was quite proactive compared to what I thought she might be. I had had a prior surgery and thought it was just scar tissue. But she wanted to send me for an ultrasound. And when I went for the ultrasound, they said we'd like to do a biopsy as well. And so they did the mammogram and then the biopsy a few days later. And it came back that, 80% chance it was calcifications, 20% chance it was cancer, and it was cancer. Mm-hmm. So then the craziness started of the journey, and I can honestly say I wasn't upset. I wasn't in tears about it. I never really cried about it. I was just like, okay, what are we going to do to fix this? Mm-hmm. And I knew that there must be a reason I was going to be going through this experience. At this point, the hardest thing for me was calling my parents and telling them, here I am in Atlanta, they're in Wilmington, that, hey, Mom, Dad, I've got cancer. And I knew that that upset them more than it had me at that time. So we discussed what to do, and of course I saw doctors there. Then I also knew as a single individual, I didn't know how I was going to go through surgery and treatment and things there, and my parents here. I was very fortunate and had a great group of friends who were there, to help me with things in Atlanta. But after meeting with doctors there and doctors here, decided to come to Wilmington and have my treatments, my surgery, and start my chemo treatments here. And that was a good decision. My mom and dad were able to help take care of me, and they had met people in the community and were able to basically be an advocate for me, and use any type of knowledge they had. And there goes the need for Hope Abounds, because we found it was hard to get some information sometimes and to know what to do. So I stayed here. Well, when I was diagnosed, I guess I should go back to that. I thought it was just stage 0 DCIS, no lymph nodes involved. And lo and behold, by the time we did the ultrasounds and the biopsies to the time I went to surgery, it had spread into the lymph nodes under my right arm as well. And fortunately, I had already prayed about and come to terms with, let me just make sure this isn't going to come back again. And let's take both of my breast and, clean margins for sure there. But when woke up from surgery and found out that it had spread to the lymph nodes, that was what I didn't want to happen, but it did.
So that was sort of the next step.
That was
so
kinda,
then what
yeah.
happened after that as far as your treatment plan?
Well, it kind of all changed because from the beginning, we just thought surgery.
Mm-hmm.
And then maybe some meds or something afterwards. But then I learned I would need to go through chemo as well as radiation. And to make sure I had a lot of good follow-ups and watch things closely for the next several years to make sure that it didn't come back and we had truly gotten everything.
So do you remember the name of the chemotherapy drugs that you took at the time?
Yeah, I remember it was called TAC.
Okay.
I guess that's taxotere, adriamycin, and cytoxin.
Very good. Very good.
So yeah, it's been a little while.
Yeah.
So yeah, I don't think I'll ever forget those.
So some people call adriamycin the red devil.
The red devil.
But I've also heard it called the red angel.
Oh, really?
Because it's life-saving.
Yeah,
That's
that's
what
true.
some people have
It's a great way
said.
to look at that.
So how long was your chemotherapy?
At the time, they told me I could only do treatment every 3 weeks because of the cocktail, I guess, was kind of strong.
Mm-hmm.
So I did 6 rounds, 3 weeks apart from each other. And by the 6th treatment, I actually did part of them here in Wilmington and part of them in Atlanta.
Mm-hmm.
By the 6th treatment, I was like, I'm done. I really didn't. I was glad that it was my last one. And I tried to work through things as well, teaching. At the beginning, it wasn't too bad.
Mm-hmm.
But as the cumulative effect, built up, I really needed a week off after treatment. So I would get my treatment and then have to miss work for a week and then go back for a couple weeks.
So what was sort of the main side effect that you remember going through with your chemotherapy at the time?
I would be okay the day after, and I would go get a Neulasta shot. That would help. But, so for 24 hours afterwards, I was fine.
Mm-hmm.
But then I started not feeling well, fatigue. After the first couple of treatments, I had a lot of bone pain.
Mm.
And I remember I think it was after the second treatment, it was pretty bad. And I actually did go to the ER for that one. And but learned, it's just bone pain and it too shall pass. Then the stomach and I guess it sheds the whole lining of your stomach and your intestines and everything. That was not very pleasant. It hurt pretty bad. And then I would just be totally fatigued for several days and just very weak.
Right.
But it would pass and I would get better and gain strength back. And
you were in Atlanta and still
Atlanta.
trying to work.
Yes.
So you finished your chemotherapy, finished your radiation, finished your surgery. Did you go on more treatment after that?
Not like chemo or radiation type treatment, just oral meds. The oral meds I started on were Lupron. Well, it was a shot, Lupron, and then Femera, and did that for a couple years, and that was great. Didn't really have any bad side effects from that. My body had been in menopause from the chemo, so the Lupron kept me in menopause so that the Femera would do its job. So it was kind of a tag team effort there. Insurance changed, and I had to change my course of treatment. And so I went to tamoxifen, and I just didn't tolerate that very well. I had a lot of trouble with that. So.
And how many years ago was this?
Well, I was
happened?
diagnosed and had surgery in 2009.
Okay.
And then, it's 2017 now, so I'm 7.5 years, coming up on my 8-year mark.
Well, congratulations.
So that's pretty big. I'm looking forward to that big 10.
So
That's
wonderful.
goal.
And so what's changed sort of in your personal life? You said you were 32 in Atlanta and you were single. And teaching.
Yeah.
What's happened sort of in your personal life, not the whole breast cancer experience. So what's happened since
yeah,
then?
I wanted my life back. So healed up, continued teaching, enjoyed time with friends, and started thinking about dating. And it took a little while to be ready for that. But I did end up meeting a wonderful gentleman who I originally thought was in Atlanta. Found out very shortly thereafter. It was a mutual friend that introduced us. He was in Ohio. And long story short, after our courtship, we got married, and I became an instant mommy. I always wanted kids, and through my journey, can't have them. And he's a widower, and God just worked it all out for all of us. So now we are a family of 6 and very, very blessed.
Wonderful.
And I relocated to Ohio.
So it is such a blessing that you're a survivor and that you have this wonderful life going. But recently you experienced a change in your health. We discussed it a little bit because it really affected all aspects of your life.
Yeah.
Can you tell us when and what and how it all happened?
You know, they say when you've had chemo, you get chemo brain, you're tired, but things get better. And I just never felt like I had my energy back. And a couple years ago, you know, after getting married, getting settled up there, I just was not feeling well, and I developed a really bad cough and was even more tired, and I wasn't sleeping at night, and the cough would always get worse at night when I would try to lay down and go to sleep. And I just thought, oh, it's because I have a family now. I'm working. I have 4 kids, but I just couldn't get better. So I actually went to the doctor, and they thought I had asthma. And went through all the asthma testing. And about the same day I went for the asthma testing, I found out that it wasn't asthma. I had actually been working with my OBGYN about needing to have a hysterectomy, just to rule out any other types of cancer coming back. You know, as unfortunately it tends to happen, you know, sometimes with breast cancer patients. So we decided the best course of treatment was for me to have a hysterectomy. Well, I went for, at the same time as I was going through the asthma testing, I went for prep for surgery, the EKG and all that, you know, for surgery for my hysterectomy, and my EKG came back abnormal. So she sent me to a cardiologist. So the same day I found out that I did not have asthma was the same day I found out from the cardiologist that I actually had chronic heart failure. And that explained why I was so tired, coughing, felt sick, and just could not get better.
So what was the treatment plan for the congestive heart failure? Did they lay out a treatment plan for you? Did it interrupt sort of the surgery plans, or what happened then?
He said, okay, no, you can't have a hysterectomy right now. We need to get this under control. And it did take me by surprise because I had no idea. You know, I'd had other EKGs. And I've had the reconstructive surgeries, and nothing ever showed up. You know, and I had done pre-ops for those. But yeah, he said, you're going to have to wait a little bit. We need to get this under control. So I started a course of meds, and also he asked me to rest and to get better first. Give my body a chance to react to these medicines. So I went down to working part-time for quite a while, and so that I could rest. And I don't remember honestly how long it was, but went back for a follow-up appointment, and he said, okay, you can have your surgery now. He was pleased with the progress. I stopped coughing and wheezing and feeling like I just couldn't catch my breath and all, but I did have to rest. I mean, that was important, and to take the meds. So I started with just a few at first, and then Over the last year, we've increased to a few different medicines and increased the dosage of a few of them. Came through the surgery fine, was able to go back on Femara, which I tolerated a lot better than the tamoxifen. And then they also said I was at a very high risk of not surviving should I go into cardiac arrest. So that meant I had to go meet another doctor, an electrophysiologist, and they wanted to put in a defibrillator so that if for some reason I go into cardiac arrest, I have much better chances of surviving.
So at that point, were you pretty frightened at things that were happening, not knowing? You were just thinking you're tired because you had 4 children at home and a husband and a full-time job. What sort of emotional reaction were you going through then?
A lot of emotions. I think there was relief that, okay, I'm not crazy. And relief of, hey, I'm starting to feel better. I can keep up with this. But then it was like, I really could, get myself in trouble here, and it could not be good if I were to, go into cardiac arrest. So, okay, let's fix this now. Kind of the same attitude I guess I had when I found out I had the cancer.
Right.
And being very thankful that people had gone through stuff before me, and that the doctors had a plan of action.
Okay.
And being able to say, okay, they know my whole story. They know my picture. They're going to recommend what's best for me, and talking with other survivors and other people and other doctors, and everybody's saying, yep, this is what you need to do. And then it was like, okay. So
you just mentioned they had experience with other survivors. Typically, a lot of us might think of congestive heart failure as something that happens to the elderly.
Right.
But in your case, you're not elderly.
Right.
But you mentioned survivors. So at what point did the doctor say, why did this happen?
I asked him.
Oh.
Why? And they were like, chemotherapy. And as I've been learning, it actually is way more common than I would have ever guessed. I guess a lot of cancer patients who have had some of the drugs that I had are having problems. And in fact, an oncologist told me they don't even use that treatment anymore because it's pretty rough. I had one tell me he never even actually had prescribed it. So
Wow.
I had an aggressive form of cancer. I'm not, mad or upset or, regret that I did it. I'm glad those doctors treated me aggressively, and I'm still here. And so I hit another bump in the road, but you manage it.
Right.
But what can we do now? Because this is evidently not so uncommon.
So will you be living with this the rest of your life?
Yeah.
You will be.
Yeah.
So I guess the way I think about it is many more people are surviving cancer now. And because of that, we're starting to see the long-term effects, maybe from some of the medications that we were given all along. Adriamycin, like I said, either the Red Devil or the Red Angel.
Yeah.
Taxol, which is paclitaxel, some people may know it as, or Taxotere. Also Herceptin, which is commonly used to treat breast cancer patients. It's not just breast cancer patients, but those seem to be sort of the big ones that can cause cardiac toxicities later on. And there's an emerging field of cardio-oncology, big words, but combining looking at the oncology population and what sort of cardiac issues it's causing. So there's quite a bit of research going on right now, which to me is reassuring.
Yeah.
So the other thing is chest radiation. A lot of breast cancer patients have had chest radiation. The good news is we're being more finite. They keep making the treatment a little more targeted as far as radiation goes. So the radiation that people are getting today is not the radiation from 10 or 15 or 20 years ago. So are you still working with an oncologist, a cardiologist? Do you still have a whole team of folks that you're working with now?
Yes, I do. And it's it's kind of a lot to keep up with sometimes. And to make sure that they all are communicating with each other on things too. But yeah, I've got the oncologist, the cardiologist, the electrophysiologist, your primary care physician, my OBGYN. Yeah, so it's a lot.
So I guess when I go back to it, it was sort of in the process of a workup that you were getting for something else. But you were experiencing fatigue for quite a while, but you attributed that to everyday life. So what sort of advice would you have for people that may be having some symptoms, whether they're a cancer survivor or not?
Listen to your body. I mean, I've always been kind of a more along the lines of a proactive, hey, I'd rather fix it now than let it get bad and have more complications later. And I don't know why it took me so long to finally, I guess it was because I was adjusting to being a mom and all that. But listen to your body and don't wait. Go be proactive, take care of yourself. The doctors they can't help you if you don't tell them you have a problem.
Very good advice.
So
I think the difficulty is now that when you have a cancer diagnosis, we all get the information about the side effects, short-term and long-term. But as you say, people focus on the action plan. How do I get rid of the cancer? Some people think of it that way. How do I make it go away? And it does come down to risks versus benefits. And that's every medicine, every treatment in the medical world, really. There are risks and there are benefits. Unfortunately, we don't know a lot about why some people are more at risk for cardiac toxicity than others. We're still trying to figure that out. There could be other factors involved. Are you a smoker, for instance?
No, I'm not. I never smoked.
No. So
never smoked.
The typical cardiac risk factors for folks, it's, maybe physical fitness, lack thereof, maybe being overweight, not very good dietary habits, smoking, family history. All those things go into sort of cardiac risk, but we still don't know. You probably didn't have a lot of those risks, and yet you still got the cardiac toxicity.
Yeah.
So you've met with your doctors. They put you on medicine. You said you have a pacemaker now?
It's actually what I ended up getting is not a pacemaker. It's defibrillator, and it actually doesn't even go into the heart. It doesn't even touch the vessels of the heart.
So how does that work?
So I have a device that was implanted over here on my side, and it's got little leads that go up under the skin here, and it turns and it goes up through the center of my chest. I have a little scar right here where they went in to secure it. So it was only 3 entry points they had to make just to tie it in. And I do checkups every several months through a Bluetooth device, and they set it so if your heart rate goes a certain speed or stops, it will shock you. But it was less invasive and really great for someone my age and somebody who wanted to still be active, and be able to go and do and not have peace of mind. It's just like a little security blanket, I guess.
Right.
And still be able to try to live my normal life. And for the most part, I do. I still have to get a lot of rest, and that's hard. I want to go and go and go and go like the Energizer Bunny. but unfortunately sometimes my battery runs out and I have to rest, not this, but yeah. So it's great. I have that, less invasive device, and it's there to help me should I ever need it. Hopefully I won't, but
That's right.
it's there.
So for all of us, we should try to be living a more healthy lifestyle. You've had some medical interventions, and you said you've tried to rest a little more often because you are limited by what you can do. What are your plans in the future for your own personal wellness and maybe the wellness of your family too?
We definitely need to make exercise more of a priority. With the CHF, one of the first things the doctor said was to start walking, which I guess exercise was on the back burner because I was so tired. And I felt like, gosh, I'm exercising all the time, taking care of a family and a house and working. But he said, no, you need to go out and actually concentrate and focus. This is your purpose. You're going out to walk for your health, or swim, or bike, or whatever. Be active. Get your heart rate up. Actually said that, hey, how are you going to make that muscle stronger? Well, it's by working it. Don't just be, a blob. And it makes sense. I mean, if you exercise and work out, you feel better. So we need to do that more as a whole family. We've already changed our diet a lot. I don't think we ate horribly before, but, he said stay away from sodium. So we eat a low sodium diet. It takes a lot longer to go grocery shopping now. I'm always turning the box around or whatever and looking at the labels and trying to make sure it's as low sodium as possible. And thinking about, if I go out to eat, being really careful there as well. And the kids even notice a difference. Now if they go somewhere and they taste something, they're like, oh, this is salty. So you adjust. But I think, through that better diet and exercise, overall, your health is going to be better, all around. So that's definitely our goal. And I have a lot to live for and cherish every moment of it. So.
Wow.
Yeah.
So if you were to sum up some words of advice for the folks that are listening, what would be your top words of advice or top phrases?
Don't wait. Don't keep putting it off. Be proactive. If you don't know what to do, get in contact with someone who does, such as Hope Abounds. Especially Hope Abounds. I mean, it's from all that we've been through personally that, we've learned so much, and that Hope Abounds was founded. I mean, they've been through it firsthand, and a lot of the people that work with Hope Abounds are survivors and have been through it firsthand too. So just don't wait. Get help. It's going to save your life. If I had waited and ignored, a couple little bumps, who knows what would have happened. God has a plan. And I know he's not finished with me. And I know that he wants to help us make it through. And through what we're able to go through, a lot of times you can help somebody else. So yeah, be proactive.
That's great advice. And we're glad you're here with us today to share your story. And I do want to say to you and to others who go through treatment, that is what's hard. You're doing the best thing for your cancer, or it could be other diseases, but there are always side effects. But the important part is to listen to your body, as you said, gather your team of doctors and family, because they can help you stay on track with lifestyle changes too. And that's all very crucial. So I want to thank you, Kelly, for being with us today and sharing your story. And it's amazing that you're sort of the inspiration, or you are the inspiration for your parents founding Hope Abounds and continuing to do the good work that they do. So I wanted tell everyone that our next live webcast will be 2 weeks from now on June 27th. Please join us then as we continue to talk about cardiac toxicities with oncology cancer survivors. We're going to interview Kim Smith, who is a local survivor here in Wilmington, North Carolina, and her husband, Ben Smith, who was her caregiver. And we hope to see you then. Again, you can watch the live webcasts on the Hope Abounds app, on Facebook, on our website, on Roku, and you can go back and watch the recorded webcast then. Thank you very much for joining us.